Hi everyone, my name is Dr. Tyler Prentice with Scenic City Orthodontics. Today I'm very excited to talk to you about something I know just a little bit about, and that's teeth. Now, normally we do this presentation in person and it's more interactive, but I'm hoping your teacher might be able to help me. When I ask a question and pause, like that, it would be great if you could pause the presentation and let the classroom answer. See how smart your students are on tooth knowledge. But I would ask everybody, raise your hand. Don't just blurt out the answer, but raise your hand and let your teacher pick who's answering so that we might learn about your tooth knowledge, see how smart you are with this tooth trivia. Here's a picture of our office. You've probably seen it a lot. It's over on Jenkins Road. It's recognizable with the big green smile on the front. You might even recognize my family from one of your schools. And this is Katie Beth and Will and Ben, and of course my amazing wife, Stacy. So let's jump right into it. Animals have teeth, we have teeth, and we might have the same number of teeth, but animals do not. How many, or which one of these animals have no teeth at all? Any guesses? The toad. I would have got this wrong because I would have thought it was a snail, but a snail has apparently 12 to 25,000 teeth. A mosquito has 47 teeth. Toads have none and frogs have some. Who knows, right? It's just the way God made us. What about sharks, though? Well, everybody knows a little bit. Sharks must have more than one because everybody's carrying around a shark necklace, right? Or a lot of you are. Now, how many teeth does a shark have in its lifetime? Up to 20,000. So they don't have to worry about brushing their teeth or biting into a hard fish bone and knocking one out. Another one will just roll on up out of one of these rows of teeth. It's crazy. But we aren't like that. We have a set number. How many teeth does somebody like me, an adult, have? 32. That's right. Well, I hope you're right. We have molars in the back, and then we have premolars, and then a canine, and incisors. Now, what about kids or baby teeth? How many baby teeth do we normally get? 20. So 20 baby teeth. And they don't have premolars, but there's molars, canine, and incisors, and they're all meant for different purposes. So when you bite into something, usually cut it with your incisors. You bite into the sandwich, it cuts in pieces, and then you chew it up in the back like that. You just kind of grind it up. So the molars are for more grinding. The front teeth are more for cutting. Now, what is the hardest substance in your bodies? The hardest substance? Well, it's not just a tooth. It's the enamel around the tooth. So the white part of your tooth is actually harder than bone. It is the hardest thing in your entire body. Pretty cool. Now, when we look at teeth, this might seem crazy. This is a real skull, but what it's showing is the rows of teeth that we do have. And this is actually really normal. So as your teeth grow, they start as little tooth buds, but then they get hard and then they start growing longer. And then as the adult tooth grows in, it'll dissolve the tooth in front of it until the baby tooth has no root and it just wiggles itself and just falls right out like a little hat falling off. That's totally normal, but right now it looks crazy because there's so many of them, but that's actually how many of your mouths look right now. Oh boy. So this is both funny and crazy at the same time. It might look a little scary or funny, but it also is very sad. Why is it so important that we have healthy teeth? Well, there's a lot of reasons, but healthy teeth help you have a nice smile. First of all, you look better with a nice big smile and you feel better about yourself. So we love to have a nice smile. What's another thing that it does? What do teeth do? Well, they help us enjoy our meals more. Remember what it's like to try to bite into an apple or corn on the cob when you didn't have front teeth? You're just trying so hard and you can't, and you're reaching around. So teeth are important for eating too. But one thing that you never even think of is teeth are important for talking. So teeth are for keeping. If I say teeth are for keeping, you try to say that, and then you picture how your tongue's moving around and the air from your mouth is making certain sounds. It's crazy how important teeth are. So if you try to say teeth are for keeping without moving your tongue like you don't have teeth, you're like, teeth are for keeping. It's pretty hard. So we need teeth for all kinds of reasons. Even Olympic athletes have special dentists and coaches that maintain their teeth, because it's really important to have healthy teeth. You can't play really well when you have a dental problem. Now, what keeps our teeth from being healthy? When we look at that one, that looks pretty good. But what we don't see is there's clear, sticky, colorless plaque or bacteria stuck everywhere there. And now this is a picture after they show what's really going on. So you might look at your teeth and you're like, I did pretty good, Mom. I did a great job brushing today. But meanwhile, all of this is there. And when bacteria are there all the time, and you eat sugar or you have an acidic drink, that's feeding this bacteria, and they produce more and more acid, and that acid attack just stays on your tooth until it becomes very damaging. So it's really, really important, because our body won't repair that enamel. Once it's damaged, once our tooth is damaged, we're not going to grow anymore like the shark. It's really, really important we take care of our teeth. Now this is a photo of someone who ate a fruit snack, a sticky dried fruit snack, an hour before this picture. They even brushed. And look, it's still stuck there. So even what we eat, like a fruit roll-up, is not the same as an apple. The two are totally different as far as how healthy they are for your teeth. So you want to try to pick good snacks and stay away from the bad ones. Now, what can we do to get rid of this? Because again, this is a picture showing they look pretty good, but then you look up close and that's gross. You can pull off all that plaque and it's just attached there. So what do? Well, we can brush twice a day with a fluoride toothpaste, just a pea-sized amount. It doesn't need to be a big long thing and you don't want to swallow it, but you just put some fluoride toothpaste on your toothbrush and brush really well. So that's the first and most important. You can floss every day. Brushing and flossing break off all that bacteria and things that are attached to your tooth so that your tooth can maintain healthy. You can cut down on snacks. That's another thing that we can do. If you eat snacks more often, then your body has a harder time cleaning your teeth and keeping them clean. You can choose nutritious foods like fresh vegetables or fruit or cheese or nuts. Those are all good ones versus like fruit roll-ups or Gatorades or sugary drinks of sorts. So here's a question for you. What is worse for your teeth? A 2 liter of Coke, like a big giant 2 liter, drank all at once with your dinner, or one Coke, a little can of Coke that you carry around all day? What do you think? Well, the answer is interesting, because you'd think it would be the 2 liter of Coke because it has so much sugar and it's so much more than one can. But the truth is, as far as your teeth are concerned, it's the frequency of how much acid, how often you're putting on there that harms the tooth so much. So if you sip on something acidic like sweet tea or Mountain Dew or Gatorade or something like that all day long, your body doesn't have time to wash your teeth with saliva, and it doesn't have the ability to get rid of the acid attack that's going on. And the acid attack feeds the bacteria which attack our teeth. So it's super, super important that we remember frequency. So the answer to that long-winded question is the 2 liter at dinner is actually better than the 1 can of Coke all day. I bet you wouldn't have thought of that. Now, when we look at these teeth, they were just brushed, and you'd think they're very clean, right? They look really nice. The outside surface looks clean, but what you don't know is between the teeth, there's all of that stuff. So if we don't floss our teeth, we'll never get that stuff out, and then all of a sudden, all of that acid, just like on the outside, builds up over and over and over, and those bacteria are never cleaned off, and next thing you know, you get cavities between your teeth. You don't want cavities anywhere, so you want to brush the outside and between the teeth. So which surface is the most important to clean? That's right, all of them. They're all equally important. We want to take care of all of our teeth. We don't want any of them to get bad. Now, Who thinks this looks like a bad cavity? Raise your hand. Who thinks this is just a small cavity? Raise your hand. Now, tooth decay is in our mouth, it's not as obvious. So sometimes you have a small little access where that bacteria goes down. Think of it like a tunnel, but then it's going into a cave. It may not be causing pain until it gets really, really bad. That's why going to a dentist is so super important, because you'd have no idea that cavity really looks like this and is a big giant cave cavity. And now it's a much bigger problem than if we caught that cavity early on. We want to see a dentist to prevent things like this. Now, when we don't clean behind our teeth or between our teeth, those cavities grow bigger and bigger. So which teeth are the most important? The front ones or the back ones? Raise your hand for front ones and raise your hand for the back ones. Well, this is another trick question, because all the teeth are just as important. We can't cut through things or bite a sandwich very easily on the side. So these incisors are super important. But then in the back, we can't chew it up very well if all we had was incisors. So all the teeth are important. They've got to be cleaned and flossed daily. Now, when we brush our teeth, it's really important. In our office, the most common area I see people miss is up on their gums. So I did the same thing when I was your age. I thought about where the sugar bugs would be. They'd be in those little grooves in the groovy surface of our teeth. But we also can't forget the outside surface. Brush half on your tooth and half on your gums. If those areas bleed at all, that's your body saying it needs more attention. So don't avoid an area that's bleeding when you brush or floss it. You need to spend more time in those spots, really giving it the attention. And after about a week of brushing and flossing correctly, it'll stop bleeding. Everything will be nicer. It won't hurt as much when you brush and floss that area. So really important, you just push through that time where it's not healthy so that you can get it healthy. So we clean the outside surface, half on our tooth, half on our gums, massaging. We clean the groovy surface and the inside surface. But there's that other surface, right? We've got to go between our teeth. So we get floss, and not just through the point of contact. We want to go up below the gums, down below the gums on both sides. So when you floss, there's two sides when you go through that one point that you want to get down to. And then your teeth will be super healthy, making sure we don't get any of those cavities. Now, braces make it really tough, and this is what we struggle with in our office, because you've got to be an extra good brusher. What happens if we don't clean around braces is the same thing if we don't clean our teeth normally. It's just that much harder when you have braces on. So all of that plaque was staying there, and then the bacteria produced acid with all of the other food and acid and debris and bacteria that was there, and it actually dissolves the tooth, and it's a permanent damaging process. So this is actually demineralized or softer enamel that just looks different, and it's stuck like that. We can't fix it. So it's really important. Any of you that have braces, take really good care of them. Really, really good. Now, one thing I like to talk about with all of you is that you all need to understand that nobody can control how their teeth come in, how many they have. I've got patients from having 14 extra teeth to be missing 14 teeth. That's kind of crazy. But some people's teeth come in real crowded. Some people come in real spaced. Other times they come in with big overbites or underbites. And it's really, really important. None of you ever tease each other about your teeth, because you can't control it. But the good news is we can fix it. So it's no big deal at all, especially until you're about 11. Everybody's got teeth coming and going in different places. And I'll have some 16-year-olds with baby teeth, and I'll have some 10-year-olds with all of their permanent teeth. So just everybody's different, and we need to be accepting of that. These are just different pictures of different things that we correct. So underbites or overbites or crowded teeth or crossbites. We fix kind of everything. And the coolest part about what I get to do is you get to see the changes in somebody. So when it starts out kind of messed up or kind of not right, then at the end we get to see nice straight teeth and it looks amazing, and we can see big smiles, and it's just tons of fun to see the changes. So it's no problem if you have crooked teeth. Don't worry about it at all. Just keep them clean. Now, types of braces, we've got clear braces, we've got removable trays, we've got colored, we've got gold. There's all kinds of different ways that we move teeth, but when we put a force on a tooth, that's how the tooth moves. So the wire actually pushes the tooth and it attaches to the tooth with a bracket. That's how teeth move. All right, so I have a really, really important question for you. At what age should you come and see me? At what age should you see an orthodontist? Any guesses? Well, there's a little hint here. 7 years old. 7 is the age that you need to be seen by an orthodontist. And that's why we created the 7 and Up Kids Club. The reason we say 7 is because that's when your front teeth are most often coming in and your back molars, which kind of establish your bite. That's when everything's coming in, and we can recognize problems that would occur in the future but prevent them. So if I get to see somebody at 7 years old, I have a fighting chance to make sure they don't have an even bigger problem in the future. In fact, I once had, I was a little bit passive about telling people you have to see me at 7 or 7 and up. And I didn't say anything to this family friend of ours, and I told her, hey, you can bring him in sometime, but I didn't really push him really hard. Whereas now I say everyone has to come in, and it's because of that situation. They had a tooth go sideways. I didn't see them until they were 11 in my office, but by that point it was too late. The tooth had gone sideways, ran right into another one, caused so much damage that they lost that tooth forever. So now, because I wasn't strict enough to say everyone that's 7 and up needs to see an orthodontist, I didn't help her. I didn't save her tooth. So I want to save yours, and I want to make sure every one of you don't have a problem like my friend's daughter had. So please, 7 and up, that's the important part. And we make it really fun. We have pins and prizes, pins like you'd collect at Disney on different milestones and years, and just a lot of fun stuff. But the overall goal is to make sure you're safe and make sure that you're not going to lose a front tooth or have something happen that could have been prevented and have a much harder experience in the future. So let's get back to the fun stuff. Fun fact: what animal are we talking about that has no top front teeth? It has the same number of teeth as humans. And most of its teeth are molars, and then it has a plate on the top of its mouth, kind of like a hard surface, and it has a really long tongue for grabbing leaves. Can anybody guess yet? Oh, yeah, definitely a giraffe, and they are super creepy. I've been up near one before where they feed them, and that tongue just it just is so gross. It just keeps going. Oh, here's another cool fun fact. Which of these animals has teeth that never stop growing? A rabbit, a squirrel, or a mouse? Anybody? Whoa, all of them. Can you believe that? I'm so glad, because, I mean, if I were that guy and you were as old as I am, your teeth would be so long. I'm just so glad that my teeth don't keep growing. But for these guys, it's probably pretty good. Just not for me. Now, this is really cool. So next time you're at the aquarium, you can be the local expert. How do you tell the difference between a crocodile and an alligator? Well, anybody? The first thing I can think of is the shape of their nose. So the alligator's U-shaped, whereas the crocodile is more of a V-shaped. And then the most important thing, or easiest thing, is when you look at an alligator's mouth, you don't see any of their teeth when their mouth is closed. But look at that crocodile. He's got teeth everywhere. He's all kinds of scary. So huge difference there. So thank you very much for listening to me today and learning lots about teeth. I hope you'll remember that 7 is the age when you need to go in and see somebody just for a checkup, making sure that you're healthy. And then don't forget all of those things about how to brush your teeth, how to care for them. Remember, you don't have rows of teeth like sharks. So take care of the ones you got. Thank you.